Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. Everything is arranged very systematically there. You can make use of it. Thank you very much. My dear friends, we have been discussing about the tips to come up with a clinical practice. Already we have covered last 4 parts. So today we will cover some of the very important aspects. Now, types of parents which comes to us. That means you can say types of parents or types of patient which comes to us. That means Ayurveda comorbidity, Ayurveda pediatrics. Now one type of patients where they are very particular and very concerned about their children. They want to nurture them only in Ayurvedic method in a very systematic and healthy way from the beginning itself. So they have got a thought in their mind. From the beginning itself, I will going to nurture my kids by Ayurveda. Okay, I will not give any other medications. They don't know. They know the adverse effects, side effects, and all those things. So they want to give only Ayurveda method. They think that this is natural. Yes, it is natural, real. This is one type of patients who are coming to us. Now we have to encash them. We have to build confidence with them. We have to develop cooperation with them. Confidence. We have to take them into confidence. And rightly you should share your knowledge with them, counsel them, and you have to keep those parents, they are very precious parents with you. And you have to also explain the pitfalls. What happens by taking Ayurveda? Yes, by taking Ayurveda medication there will not be any abrupt fall in the fever, but definitely in future when you take the Ayurvedic medications, the number of episodes will come down, number of time child get infected, that will come down. So these things you have to explain them. Second type of the patients, they have got some prior knowledge of Ayurveda, and also they have got some experience with Ayurveda, and also the flow core medications. Therefore they are coming. Yes, these are the other patients because they know something about Ayurveda. They also taken other medication for a long time. At the end they shifted to Ayurveda. They got the benefit, and they now think that the same should be given to their kids also. They are coming to you. So here also these are the precious patients, and you have to develop a very good rapport with these patients, patients or parents, and by taking them into confidence. Third variety of the patients who are coming to you is they are very rigid of giving allopathic medications and due to adverse effects. Okay, they may have the bad experience or good experience, whatever, but they are very rigid. We will not give any medication. From the beginning itself also, I have not taken any Ayurveda allopathic or any other medications. I have only taken the Ayurveda medication, therefore I am coming. This is another type of the patient. Some is there, they tried with other medications for a long time, but their problem is they are only getting symptomatic relief. So they say that as far as I am taking this medication, this is okay, but when I leave this medication, again the problem starts. Therefore, I want a permanent solution for this. Therefore, I am coming to Ayurveda. This is another type of the patients who are coming to you. Now, one more is they tried giving other medications, but worried about the continuous lifelong medications. Now, this is the problem. So they have started some modern medications and all, but now they are worried about this lifelong use. That means my child has got one seizure episode. They have started some medication. Since last 5 years I am giving these anti-epileptic drugs. Now I am worried because there are so many adverse effects of these drugs is there, and they are not even stopping these medications. They are telling that you have to continue for next 2 years. So this type of patient will come. Similarly, diabetes 1 patient, so they are taking insulin. Now patients are desperately want to desperately visit a Ayurveda physician or a pediatrician, telling that we want to stop this insulin, and we try to convince them you cannot stop the insulin at once, it is not good, but still parents are insisting us to stop the insulin. Okay, this type of patient will come. Similarly with the asthma, is always taking these particular inhalers and all. I think inhalers contain this bronchodilators and this steroid and all. For long-term use it is not good, so I want to shift to Ayurveda, please help me. This type of patient will come to you. Nephrotic syndrome patient will come to you. atopic dermatitis patient. See, all the patient after a certain part of the time, all these chronic problems are there, or autoimmune problems are there, one or the other day they will come to the Ayurveda physician, Ayurveda pediatrician. But only thing is we should be ready by that time to extend our help to them. Okay. Now another time is you should not concentrate more. Again, repeatedly I am telling you, we should not concentrate more on this simple fever, respiratory tract infection and all, because there are so many doctors are there who are treating them, and it is not sure that whether they are coming for the next time or not, isn't it? So they want a temporary relief now, they want to get down the fever immediately, and next time they may visit another doctor. It is not quite sure that again they will come to you only. But a chronic patient who is coming to you and you are giving only 5% release within 2 months, but definitely he will come to you for next 2 or 3 years. Provided if you give some relief, he will be your permanent patient and also bring so many patients with you, to you. So chronic problems where other medical systems have no answer, these are our patients. You remember it. These are our patients. We should try to give him, you know that it's a chronic problem. Giving a result is very difficult, but if you are able to give only 5% results also to them, okay, definitely they will come you. When they come for a longer time, definitely you will give the good results. The problem is why you are not able to give the results. The patient is not coming to the follow properly. He frequently change the doctor. Okay, in the chronic problem already he has changed the doctor so many times. He coming to you, and now if you are giving some relief, definitely he will not leave you. He will come to you continuously for the follow-up. Okay, so these are some of the type of the patients who are coming to you. Now it's left to us what we have to do for this. Why can't we start a well child clinic? This is already we have discussed. Parents are in the nuclear family nowadays. They don't know the common basis of child care also. Okay, so if the child is not passing the stool, immediately at least you have to give some tap on the back of the child, or you have to give some massage in the abdominal portion. This also they don't know. For them, for that they will come to you. Okay, so the reason is very simple. There is no senior citizens in the home now in the nuclear family, so they are helpless. They run to the doctor for simple problems also. Many times they rush to the clinic to confirm it is normal or abnormal. ओके कल जो है सुबह जो है मेरे बच्चे ने 2 बार चीखा था, तो चीखते वक्त थोड़ा वैसी आंख सब ऐसा ऐसा किया था, डॉक्टर साहब ये नॉर्मल है एबनॉर्मल है, इतना ही पूछने के लिए वो आपके पास आएंगे. Okay, so more than a sick child clinic nowadays, well child clinic is a more appropriate. So why can't you start an immunity clinic? Yes, this is another option. You can start an immunity clinic also. Everybody is worried about the immunity of their kids. You only give the heading to your, that means board to your clinic, child immunity clinic, that's all. Okay, no other things, only medication to increase the immunity. Okay, prepare immune enhancing preparations and prepare a protocol for that for different child. Counseling methods. You can also have the immunity kits. Okay, so this is one more option. Now types of parents usually which comes to us, yes, not gaining the weight. See again, now you have to think what are the possibility that I can extend the service here. Not gaining the weight, not gaining the height, loss of appetite, constipation, skin problems, weaning advice, hair fall, vitiligo, shaya mudra, obesity or failure to thrive, obesity and failure to thrive, physical disabilities, cerebral palsy, muscular dystrophy, ADHD, autism, learning disabilities. This is a list of conditions where parents are definitely coming to Ayurveda. Okay, so thinking that there is no scope of Ayurveda pediatric practice is totally wrong. We need to change our mindset. That is a very important thing. Okay. So I hope I covered many of the things, and this is what I want to say, that we should change our mindset. That is a very important thing. We should read the pulse of the people. Accordingly, if using some common sense, if you start your practice, definitely you will going to get the success. Thank you very much.